We're here today to talk about alcohol withdrawal and how to know when to get help and when it can be managed at home. So alcohol withdrawal occurs with cessation of drinking or abrupt decrease in the amount of alcohol. It usually occurs in people who are very heavy drinkers who drink daily. So early withdrawal symptoms can start about 6 to 12 hours after the last drink. And usually those symptoms are things like agitation, insomnia, anxiety, some tremors, maybe some fast heartbeat, sweating, headache, nausea, vomiting. Usually people are coherent. They don't get disoriented at all. And usually that resolves in 1 to 2 days. If it doesn't resolve, it can go on to a more severe withdrawal syndrome. And seizures can happen in that first period. But usually seizures only happen between 24 and 48 hours after the last drink. And it only occurs in about 10% of people that withdraw from alcohol. And seizures are generally generalized seizures, and they're usually single seizures. So if seizures do occur, they usually stop after one seizure. So if withdrawal does progress onto more severe symptoms, they usually occur around 72 to 96 hours after the last drink. And there's a couple different syndromes, basically. One is called DTs, or delirium tremens. And what it is basically delirium tremens, right? So you're delirious. Cognition is not there. You don't know where you are. You're disoriented. And then there's fever, agitation, hallucinations. And the mortality of that, if untreated, is about 40%. And people die of things like heart attacks because their body just can't withstand the adrenaline surge, basically, that happens. The risk factors for that are if you've ever had DTs in the past and if you're over 30. And then the other syndrome is called alcoholic hallucinosis. And basically that is similar to DTs, only the adrenaline surge is not there, so you get the hallucinations and the disorientation, but you don't get that adrenaline surge with the fevers and the agitation. So how do you know if that's going to happen to you, and if you're going to have a seizure, or where you should seek treatment for detox if you think you might need detox? Generally, if you are a daily drinker, you will probably need some sort of detox, or you will go through some sort of withdrawal. Signs that you might need some sort of inpatient or need to seek out a detox center are if you're pregnant, for sure. If you have some sort of severe psychiatric syndrome, like severe depression, have been suicidal in the past, bipolar, schizophrenia, those kind of things. If you've ever had severe withdrawal in the past. If you have any sort of cardiac disease, like if you've had a heart attack in the past, if you've ever had any other medical complications from alcohol, like liver disease, cirrhosis, or gastrointestinal bleeding, if you're over 60 years old, those would be indications that you would definitely need some sort of inpatient hospital or detox center. If you go to an emergency room and in alcohol withdrawal, if you have one of those things, or if you seem like you are unstable, like your blood pressure is low or something like that, you'll probably be admitted to the hospital. If you are not unstable, your blood pressure is normal, they'll probably transfer you to a detox center. And usually emergency rooms have detox centers right within the same city. Indications that you may be able to withstand withdrawal from an ambulatory setting are if you've never had severe withdrawal in the past, especially if you've gone like a week without drinking and not had severe symptoms. If you have no history of like severe DTs or seizures, if you have no medical conditions, if you have no psychiatric conditions, if you're not pregnant, and if you have no other substance use disorders. So if you're trying to withdraw from 2 things at once, that would probably be an indication that you need some sort of inpatient or detoxification center for withdrawal. So that's alcohol withdrawal.